Hi, my name is Dr. Linda Wang. I'm a general internist and addiction medicine physician in New York City. I'm also the medical director of the Hepatitis C and Drug User Health Center of Excellence at Mount Sinai. In 2020, drug overdose deaths peaked in New York State. Nearly 5,000 people died. This is a 37% increase in overdose deaths compared to 2019. Provisional data at the national level show a steady increase in overdose deaths since 2020. And data also show higher rates of overdose deaths in Black and American Indian and Alaska Native communities. And both trends, unfortunately, may be mirrored across New York State. The almost 5,000 lives lost to drug overdose in 2020, and those who lost their lives to overdose before and since then were our patients. These numbers not only help us as clinicians to understand the magnitude of the crisis, but can also activate us to identify ways we can change our practice to help reduce overdose deaths. One example is to provide overdose education and distribute naloxone. So what does providing overdose prevention education look like? It means providing your patients and their friends and family members with take-home naloxone kits or prescribing naloxone to your patient's pharmacy. And as of this month, August 2022, there is a statewide pharmacy standing order for naloxone so that pharmacies across New York State can carry naloxone and dispense it without a prescription. It means teaching your patients about overdose reversal, including how to recognize signs of overdose, the importance of calling 911 and getting help, and the steps to administering naloxone. It also means providing harm reduction education, such as safer drug use practices, including where and how to access sterile injection equipment for those who inject drugs, such as at local syringe service programs. And if you practice in New York City, you can refer your patients to one of 2 overdose prevention centers operated by On Point NYC, which are the first legally sanctioned centers of its kind in the United States. Since opening in November 2021, these sites have reversed hundreds of overdoses and provided other life-saving services for people who use drugs. And importantly, no fatal overdoses occurred on site. So in summary, clinicians can play a critical role to help keep people who use drugs safe from overdose. In addition to providing naloxone and overdose prevention education, clinicians can provide medications to treat opioid use disorder, such as buprenorphine and methadone. To get training and resources on these topics, please go to our website, ceitraining.org, where you will find on-demand and live clinical trainings, as well as links to additional resources for your practice. People who use drugs are our patients, and we must do everything in our power to keep them healthy and safe.